What usually causes depression in teenagers specifically? Is it things like school pressure or family or social media?
I think this is the period or a phase of life which demands a lot of adjustment and a lot of coping. No other phase in life would require so much of coping, with so much of change.
Hi everyone, I'm Vivaan. I'm 17 and currently studying in New Delhi. I've always thought about depression, anxiety, and various aspects of mental health. Today, I get my answers to all of those questions. Here, I am joined with Dr. Niveditha from Sukoon, who would answer my questions on the topic of depression, especially for teens. Hello, Dr. Niveditha. Thank you for joining us today.
Hello, Vivaan. Thank you for having me here. What makes you choose this topic?
Well, I had a friend who was going through a rough patch recently, and I couldn't differentiate whether it was a temporary rough phase that he was going through or whether it was depression. So, how do we differentiate between probably sadness or loneliness for a temporary period or something that's depression?
Yeah. In both the conditions, you're feeling low, don't want to talk to anyone, you can't sleep well, you don't want to eat, you don't want to interact. Yeah, that can be confusing. But a rough patch would follow an event of disappointment, say that something has happened, not according to your expectation, and then you are feeling low and all these symptoms would fall. It takes a longer time. I would say that depression as a disease is something which is inability to bounce back. So a rough patch, you would still bounce back, given in a duration of time. So arbitrarily, it is taken that it is 2 weeks. But depression tends to hang on and goes deeper or even can get worse over a period of 2 weeks and can last and stick around for longer. In a rough way, even during a rough patch or a depressive state that has occurred in, you would still do things which makes you happy, like playing with a pet, playing and listening to music, watching a movie or something. All this will at least temporarily make you smile and forget that what has happened with you, and you are able to come back. But in depression, that doesn't happen. People usually report that things that you used to enjoy before are no more pleasurable. So this is typically known as anhedonia, which is loss of pleasure for all the pleasurable activities before. And the last but not the least, I would say that if you're having thoughts about not wanting to be here, not wanting to exist, wanting to harm yourselves, thoughts of harming yourselves, all these things, you're not definitely dealing with rough patch. It is depression, and I think it needs attention, and we need to seek help the earliest.
So, doctor, can we say that all these are few factors
Yeah.
that can either lead or these are actually symptoms of depression?
Yes.
So we can call them symptoms of depression for
Yes.
sure. Okay. What usually causes depression in teenagers specifically? Is it things like school pressure or family or social media?
Yes, there's a lot of changes happening, as I said, during adolescence, which the child has to cope with. I think this is the period or a phase of life which demands a lot of adjustment and a lot of coping. No other phase in life would require so much of coping, with so much of change. And yes, it is a period you are looking for validation, you're comparing yourself, you're trying to build yourself actually. This is building mode. So obviously, any disappointment here and there can really take you low. And if many things get piled up together, one after the hit, sometimes, then that can definitely lead to depression. And whether it is school stuff, yes, in a high school during adolescence, your curriculum naturally is becoming tougher, harder, and many children are discovering their drawbacks or their inabilities for the first time. It can be a challenge to deal with. Yes, school pressure can be there, but supportive, educational environment, supportive parenting can definitely help them go through these difficulties. So yes, family drama or other things can affect the child. And apart from that, the social media, yes, these days I think social media is having a huge role in influencing and mitigating the way one feels about themselves a lot.
So both the external and internal factors play a very
Yes.
huge role in
Yes.
shaping.
Yes.
Yes. Okay. So, what kinds of treatments work for teen depression specifically? And do things like meditation or therapy help?
Meditation, I would say that is like an exercise. If
Hmm.
you're physically fit, you take it ahead to build your muscles, right? But if you're sick, say you're suffering from fever or flu or something, can you really go for bodybuilding? Maybe no, it will break you
No.
further.
Yes.
So, meditation is an exercise for a normal brain to increase and build your capacity higher. And therapy, yes, therapy is by clinical psychologist or a counseling psychologist who are trained in that. Yes, mild to moderate depression therapy alone is enough for the child to get better.
Okay.
Right. But if it is going severe, then yes, it needs to be seen and treated like any other illness.
When we talk about medication specifically, there are a lot of medications out there in this world, and there are lot of new controversies that are coming about. So, which ones should we trust?
Yeah, it's not about preferable. As such, see, depression is like any other illness, as I told you, and it needs to be treated. If needed for severe depression, we need to add medication, that is antidepressants. There is a lot of myth around these medications. Parents most often come and say, are they safe? Their growing minds, will they get addicted to them? Once started, is it required for them to take them for a lifetime, and all these things? These are all myths, I would say. Not at all. I would say which only requires treatment for a certain period of time. So the best way to treat is with medication and therapy as well. So we have a lot of different kinds of therapies like CBT, and medication are also absolutely safe to take, and your doctor, trust me, your doctor knows when to start and when to stop the medication. And as long as it is helping the child, I think we shouldn't look back on it at all, and they're absolutely safe is what I can assure.
So, what's the best way for a young person to open about depression, either to their parents or friends or a trusted one?
Yeah, the best one. That's a tricky and a very good question, I would say. The best way is start with first finding the right person,
Yes.
right? The right person whom you feel safe, who can keep your information, and then handle it with care and sensitivity. It can be your teacher, it could be your mother, it could be your father, it could be an aunt, uncle, an older sibling, or it could be a parent of a friend or whoever. So look for the person whom you feel safe with, and then you can start with some small sentences like, I'm not feeling okay these days, and I think I might be needing some help on something that is eating me up. Or most of the times children who are severely depressed are not looking for it. So I think the onus of recognizing that they are depressed falls onto the people around them. So this is how you can go about.
So, the most trusted person, you would say.
Yes.
The one. Thank you so much, Dr. Niveditha, for being with us here today and talking specially about depression in teens.
Thank you, Vivaan. It was wonderful to share all the information with you. Depression is as real as falling from a bike and getting hurt. This hurt might not be visible, but if you look for it, you will find it. If you see the signs of depression in yourself or in people around you, please reach out for help. Asking for help is a sign of strength, not weakness.